Omar? Is Omar here? No. Josh Land is here, and Kimberly Alley is not here as well. Okay, so we are going to go right into the report on vaccines. We are in, we're in a time right now where there are three major vaccines that are being given and being encouraged by the Department of Health and Mental Health and others in the healthcare world. Yes. Kenneth Johnson. And that is for flu, COVID, and RSV. And as with everything in the world today, and I don't think anything in the world today can step outside of the world of controversy. It's just, unfortunately, we all include everything under the world of controversy today. All three, I'm sure, have found somewhere where someone is controversial about one or the other or all three. So I felt it was important, we felt it was important that we bring in someone from the Department of Health and Mental Health to unpack for us what is the status and the various different pieces of facts and information around the various different vaccines that are being promoted in the world today. Just as a side note, I'm actually on my way to Senegal Saturday night, and there you have to take some vaccines that you guys have never heard of. So I never thought I'd have to take one for yellow fever. However, these three vaccines are the most common given in the United States today, and I'd like to call upon Kenneth Johnson from the Department of Health and Mental Health. Kenneth, if you can give us the background and the information, then we'll have a little Q&A afterwards around these three vaccines, and I want to thank you so much for being with us this evening.
Thank you so much for the introduction. Good evening, everyone. Hope everyone's doing well. My name is Kenneth Johnson. I'm on the community affairs team at the health department. I am the community liaison to the borough of the Bronx. So our team works with local elected officials' offices, city council members, state representatives, and of course the local community boards. So we're your first point of contact in terms of addressing day-to-day constituent issues, anything ranging from, pest control to, securing different documents, birth certificates, death certificates. And we're really here to help and support you all in your efforts. So with that being said, I will dive into my report. I have a few updates for you all regarding COVID, flu, and I'll touch on RSV as well. So just to kind of lay the scene here. So we in terms of COVID cases, severe outcomes of disease. So think of hospitalizations and deaths, have thankfully been steadily decreasing over the last couple of years. We've made a lot of progress, mainly due to the vaccines that we have. There have been multiple updated vaccines at this point. Of course, there was the original vaccine back in 2021. There was the bivalent vaccine that I'm sure most of us probably have received at least one dose. And now, starting, I guess it's been about a month or so, we have another updated vaccine. And this one is specifically tailored to combat the most recent variants that we've been seeing this summer. And just for everyone's information, there are some relatively new COVID guidelines in terms of what it means to be fully vaccinated. So at this point, if you receive one dose of an updated vaccine, that's the one that's available right now, then you are considered up to date. Obviously it's great that, people were up to date with their previous vaccinations, the vaccination schedule, including the bivalent vaccine. But now, we're entering flu and cold season. And so we definitely want to encourage people to receive one dose of the updated vaccine that's available now. The rollout of these vaccines is a bit different than what we have seen previously. If you remember some of the city-run sites, state-run sites where people could go and queue up for their vaccination dose. That's not how the vaccine is going to be rolled out. That's not how it's currently being rolled out. The previous rollouts and all of this infrastructure related to really getting the vaccine out as quickly as possible was mainly due to the public health emergency that was declared by the federal government. That declaration has ended, and so now the vaccine is entering the market via commercial avenues. So think about how you would go about accessing a flu vaccine or another required vaccination. You'd usually go through your primary care provider or local pharmacy, something to that effect. So think of CVS, Walgreens, those types of establishments, and that's for the new updated COVID vaccine. I'll share a couple updates on flu and RSV, and then I'll pause for questions, and then we can dive into some data in the district if that works for everybody. In terms of flu updates, flu vaccines are also available. Of course, this is the seasonal flu can be very deadly if people aren't monitoring their symptoms. The flu vaccine, like previous years, it will be available at pharmacies and through primary care providers. There are some flu pop-up events that will be announced on our website, and I'll share the link to our seasonal flu website here in a moment. We also, our clinical partners at Health and Hospitals also have flu vaccine available at most of their facilities around the city. And I can also share a list of those locations as well. We also will be having publishing a weekly influenza surveillance report. And this basically, it gets a little technical at times, but it kind of goes in depth and shows some of the trends that we're seeing, not only in the city, but also on a much larger scale. It has, some comparisons of previous flu seasons versus the current flu season. We have not yet published a report, but when we do, I'll be sure to share with all of you all. Now on to RSV. Just briefly, RSV is it's another respiratory virus. It usually affects older adults or younger children. There are 2 vaccines available during this flu season, this cold flu season. However, they are only available for individuals age 60 and older. And these are also available through primary care providers. And we recommend at the health department that people really discuss with their doctor, with their primary care provider, to determine which vaccine is right for them and whether or not vaccination is the right course of action to take. So I know I just threw a lot of information at you all, so I'll take a pause there and see if anyone has any questions.
Any questions here? No? Okay. Any questions from those on Zoom? I have a few. I know that there was some questions about the effectiveness of these various different, obviously each one is a separate vaccine. Do you know what the effectiveness rate is now predicted to be for COVID and flu and the RSV?
I don't have an exact number for you. It'll take some time before we're able to, kind of estimate the efficacy of the current vaccine. There are some studies that CDC had published previously on the bivalent booster, and I apologize, I don't know those numbers off the top of my head, but I can find them. We use them in some of our presentations. I want to say it was, roughly there was some level of protection even after 3 to 6 months, something to that effect. I know that's very vague. That's all I can remember, but I'll find the article and share with you all when I get a moment. I'll do some Googling.
Yes, and please, any information you have, since it's very hard to tap into the chat, if you can just email to Pablo, who got in touch with you, and he'll get it to us, we'd appreciate it, and we'll include it in our minutes from the meeting. Another question is cost. We know that during the COVID emergency, all COVID shots were, they didn't cost anything to anyone. They were all covered, whether it was by government or by the insurance companies. What is the present state cost of the COVID, flu, and RSV?
Yeah, so that's a great question. So, you know, as you mentioned before, the COVID vaccines specifically were available at no cost because of the declaration of the public health emergency by the federal government. Now that that's ended, and you know the vaccine is being rolled out through the commercial markets, this means that if you are insured and you go to receive a COVID vaccine, your insurance would be billed for that service. So you know I can't say how much it would be, you know, because you know everyone has different insurance plans, but it would be billed through your insurance. We suspect that it should be at low to no cost to the consumer, but it really depends on each individual's insurance. Now, if you're underinsured or not insured, there are some options for people to be able to get vaccinated. Our website, the city-run site, Vaccine Finder, NYC Vaccine Finder. I'll share, make sure.
You just froze. You just froze. You might want to close your camera just for a minute. Sometimes that corrects the freezing.
Oh no, my internet.
Can you hear me?
I can hear you. Can you all hear me?
Yeah, we can hear you now. Yes, please.
Okay, great. I think I just had a little hiccup with my Wi-Fi. Okay, so so if a person is underinsured or does not have insurance, there are still options for them to get vaccinated at no cost, or little to no cost. And these facilities that are offering vaccines to underinsured or individuals with no insurance can be filtered on Vaccine Finder. If we have some time later, I can, you know, I'm happy to show you all the website and show you exactly how you can filter locations by insurance type. And so, you know, just I say all that to say that there are options for, you know, people who do have insurance and people who don't to still receive the vaccine.
Okay, I deeply appreciate that. And do you know if an insurance company can deny your claim for a vaccine?
That's a great question. I do not know the answer to that.
I really deeply appreciate it. Any other questions from anyone else here around the vaccines? Okay, Kenneth, you said you had some of the data that you wanted to unpack with us now.
Yeah. I just give me 1 second if I can share. I don't have screen sharing privileges. I'm not sure if you all could.
Let me see if I can do that for you. 1 second. Okay. Sure. No. Okay, you should be able to screen share now.
All right, thank you. So let's see here. So can we see this? Can you all see my screen? Okay, great. So I'm on the main COVID page, actually the vaccine page rather. I just want to make sure that, you know, we all know how to get here, just in case people want to do some further research. So we are on the COVID data page right now. I'm going to turn off my video just so I don't strain my internet. Okay, so here we have, you can see just a general summary of some of the data that we're seeing. When we go to transmission levels, this gives us a better picture at, the last few months in terms of the cases that we've been seeing. We have, each borough noted here, and we can search by neighborhood, which is great. So District 8, that's what, Northwest Bronx, Riverdale area. Is that correct? Hello? Can you all hear me?
Yeah, you hear?
Yes.
Oh, okay. Is Riverdale? That's in the district,
That was
right?
Riverdale, yes.
Okay, great. And we can look up other neighborhoods as well. This is just, just kind of just to show what our data page looks like. So here we can see, we've searched the zip codes 10463 and 10471. And the pink line here represents the Kingsbridge, Riverdale neighborhoods. And we can see that, we've seen a little more than 115 new cases per 100,000 in the last 7 days. This bold black line is the city average, the entire city. And this green, oh yeah, and this gray line is the Bronx. So until a few weeks ago, Riverdale, Kingsbridge, Riverdale was a little bit higher than what we were seeing citywide, and it still is, although we have seen a pretty sharp decline in the last few days or so, or the last month rather. And then of course, you can compare the neighborhoods based on cases per 100,000. We also we can look at hospitalizations and death, which some of these numbers, well, there have been some issues with now that the public health emergency has ended. Facilities aren't required to share all of their data, and so we try to put together the picture as best we can. However, we aren't able to report percent positivity because labs are no longer sending test results to us. And so, when we talk about some of the more severe outcomes, seeing deaths be low, seeing deaths at a low number is a positive sign. That means that people aren't getting nearly as sick as they were previously. So if we search, so we can see Riverdale is looking at about less than around 38 hospitalizations per 100,000. And then the Kingsbridge, Marble Hill, Riverdale neighborhoods are even lower at about 30 hospitalizations per 100,000.
What are some of the factors that of that could lead to hospitalization?
So definitely think of, other underlying conditions, obesity, any cardiovascular diseases. Since COVID is a disease that affects the respiratory system, any kind of pre-existing conditions that affect the lungs, anyone who is a smoker, all of these factors can lead to a more severe outcome if a person does get sick. And this is part of the reason why, we want people to really monitor how they're feeling, because if you start to get sick, you really want to be aware of the symptoms that you're feeling in order, and so when to seek care. Because sometimes if people wait a little bit too long, the outcomes can be much more severe. So now I just quickly want to show you all the NYC Vaccine Finder. So here on our vaccine main page, there's a link to find a COVID vaccine, and this should take us to NYC Vaccine Finder. And here you can select which vaccine you're looking for, whether it be COVID-19, flu, or monkeypox. And you're able to filter by insurance here. and you can filter by adults and children. So if we select the, so for COVID, if you lived, so it looks like most of these are some of these are clinical partners at health and hospitals facilities, which is great. And even some pharmacies as well. So there are a couple CVS pharmacies. Let's see, what was the zip code? 01463. Yeah, so let's see what we have close by. So we have this nice interactive map that comes up. So it looks like there is a Walgreens, Duane Reade, another Walgreens, and a CVS, all within half a mile, it looks like. So there certainly are some options for, underinsured or individuals with no insurance to still be able to receive the COVID vaccine. And just briefly before I stop screen sharing, I just want to navigate to our flu website here. So this is our seasonal flu page. You can find it just by searching, DOHMH flu. Here is another link to our NYC vaccine finder. I just want to flag that here, this link here, our upcoming flu vaccination events. This will have a list of any of our pop-up vaccination events that might be happening in the city. There aren't any scheduled right now, but once we do schedule those events, they'll be updated at this link. And then, of course, I just want to direct you all to the our weekly influenza surveillance summary. Like I said, we haven't yet published anything for this flu season, but this will be updated weekly with some of the trends, not only just in New York City, but also nationwide. So I'm gonna take another pause there and see if there's any more questions.
I have a question.
Of course.
Hi, this is Julie. In your chart where you show the hospitalization, it shows the Kingsbridge area was lower than in North Riverdale. Would that take into account if you find that the lower income communities do not go to the hospitals as much as other neighborhoods? Would that account for the lower percentage of the Kingsbridge area being a lower hospitalizations? And if so, do they put that into account when they're doing the numbers?
So if I'm understanding you correctly,
or two part, do the lower income people go to the hospitals less so than a higher economical area? That would be the first question.
Got it. So I mean, it's a very nuanced question. Of course, we know some of the more disadvantaged neighborhoods, lower socioeconomic areas, the people that live there may avoid going to seek medical care because of the cost, also because of other factors. Not knowing when to seek care is a big one. It's difficult to make direct correlations on that, but we do know that these environmental factors do contribute, some of the to contribute to some of the quality of life issues that we observe.
So would they make a notation in that chart, because that chart makes it seem as if though the Kingsbridge area, and I think the Spuyten Duyvil was in that section, that they have a lower percentage of hospitalizations, which would give a false reading to some, thinking, oh, that's great, they're not as sick, because basically it could be because of the area and the all the other qualities that go into it. So will you make any notations in that chart, or look into and ask the people in the area, or if they come in?
Yeah, that's a great point. So what we used to do, and I'm not sure if we still do this, given some of the limitations of the data that we receive at the facility level, but what we used to do is we were able to compare some of the case rates or the hospitalization rates with the testing rates in neighborhoods. So for example, per your statement, if we suspect that maybe people aren't seeking care as much as maybe we or maybe as in other areas, right? We can look at the data to see where people are going to get tested, and if the numbers are lower, but if the number of tests are low, You know, and we're also seeing other data that maybe reflects, you know, what, you know, whether or not people, whether we think people aren't going to get tested, you know, then again, you can't say for sure that that's the reason, but you know, we can make a relatively educated guess. I think at the moment with the data that we currently have, I think it's difficult to say, to say for sure whether, you know, where people are accessing care, and you know, if you know, if there's, if people are in fact not seeking care when maybe they should.
Okay, thank you. I would suggest that that area would be one. Thank you.
Okay, that's good to know though. Thank you. You know, we have our satellite office in the Bronx. It's on Arthur Avenue or Tremont. It's the Bronx Neighborhood Action Center, and they have a big hand in a lot of some of the you know, community outreach that we do, especially more localized outreach in the Bronx. So I can definitely share that with the team.
Thank you.
Yes, please.
Yes, sir.
Saying that there are minorities that are excluded.
You got to speak louder.
Really, this is Josh Land speaking. You're saying that minorities are excluded. I don't think that chart shows that.
I'm sorry, minorities are excluded from what?
Because they don't seek health care.
I'm not understanding the question. I'm sorry.
It just shows reported cases. It's not based on socioeconomic or race. If we wanted to do a race economic study, we'd have to do a broader outreach.
We need more data,
We need a lot more data.
and the data's a little
And
iffy
it's
right
not-
now
it's-
anyway.
It's not self-reporting from hospitals. You'd have to see people who actually don't seek treatment. And it could be a number of reasons. I know I don't go to the hospital if I'm busy and rather go to work instead of waste a sick day.
I'm trying to follow the
The
conversation.
issue of
I'm sorry.
socioeconomic issue is a deep one, and it could be addressed. You're saying, but that subset of data doesn't quite address the deeper issues. There are deep issues there, but that data set won't address it.
The data that we see is just cases, hospitalizations, and deaths, correct?
Stuff that's reported.
Yes, that's the data that the city collects.
I mean, you can speak for herself, obviously, but there are two neighborhoods side by side.
Sure.
One is definitely more black and brown, one is more white, one has greater access to resources, the other has it. So I think she's trying to pull that apart.
And there are issues there, sure.
And so if there are neighborhoods side by side, what's the reason why there's a difference, a gap
Interesting.
in the number of cases, right? Because it's not like you're measuring a neighborhood in the Bronx and then you're measuring a neighborhood in Montana, right? You're looking at side-by-side neighborhoods.
That's exactly it. And we do have data through the Census Bureau and all other surveys that show that the Kingsbridge area is definitely economically less than North Riverdale. So there is data out there. That's the reason that I was pointing that out. But Margaret, you're right on target. That's exactly it.
We did have data during the height of COVID, where there was real verifiable data during the height of COVID that communities of color those who would die from COVID was 3 or 4 times the number of other communities here in New York. We also know that hospitalization, I don't remember the exact numbers on hospitalization, but it sort of mirrored that those numbers around death by COVID. So I can only imagine that those disparities have not changed, but they're not just what we're hearing from Kenneth is that the amount of data that was collected at that period of time was much harder than the data that's being collected now. I can only tell you from my own experiences of being involved in healthcare and sitting on the compliance board of a federally qualified healthcare center, that the issues of healthcare disparities have not disappeared. nor have they dissipated in any shape, manner, or form. So while we are working with older data to understand the impact of healthcare disparities upon populations, particularly socioeconomically challenged communities and communities of color, I can only imagine that that has not shifted all that much. However, again, you cannot quantifiably say it from a data-driven point of view.
Well, what's also curious is that Kingsbridge, which lays along the Deegan, which the exact, the entire corridor along the redlining to health outcomes to deaths by COVID, you can just lay those maps all on top of each other, and it's the exact same corridor that, you know, poor health indicators, poor
We lost your audio.
Can
Hey,
you all hear
Steve.
them? I can't hear them.
No, can't hear them either. Maybe they'll look up and see Steve's hand. Steve, wave at them. Oh, now we hear them.
Okay.
The 62 counties in New York, the Bronx is the lowest, the 62nd in healthcare indicators overall. And that has not changed, by the way. That has not changed in decades.
Not a good job.
It's rather unfortunate. Again, if we dig back down into data, don't have it in front of us right now, and I'm sure Kenneth cannot sort of extract it from the air at this point in time because he's dealing with the issue of a very specific focus, is that the North Riverdale area more closely tracks the rest of the city as far as healthcare indicators, as opposed to the Bronx, which does not track the rest of the city. So I'm sort of jumping ahead a little bit, and just if you excuse me, to what are going to be our priorities. Healthcare disparities is one of our priorities. We talked about it last time, and that we will bring in speakers who will be able to, unpack the data, not just from the Borough President's Office, but with the Academy of Medicine and others who have done some really deep research on the impact of healthcare disparities, not just around the issue of COVID or any of the other seasonal, now COVID is just not even seasonal, it's all year long, but the issues like RSV and the flu, which is seasonal, on some very, very major issues, ranging from mental health to maternal health care to cancer rates to asthma rates and on and on and on. All the chronic illnesses that are the indicators and the measuring points for healthcare statistics in the state. Obviously, the Bronx has the worst numbers, and if you overlay that with the population, the issue is that the population is primarily those of color, and therefore there's a correlation there. But we'll get some folks in to really take a deep dive into that in the near future. Any additional questions? Yes, Steve.
Hi, I thank you for your presentation, Mr. Johnson. I had a couple of questions. The first is there any recommendation from the Department of Health and Mental Hygiene about whether it's okay to get the COVID vaccine and the flu vaccine at the same time?
Yeah, that's a great question. It's not uncommon for people to get both vaccines at the same time. When we rolled out the bivalent booster, I guess it's been almost a year now or more, maybe more. The recommendation was, if a person felt, if you don't mind a little bit of soreness in both arms, then there's absolutely no health risks associated with receiving both vaccines. However, that's only for, you know, COVID and flu. Any other vaccines, like if you wanted to get the flu and the RSV vaccine at the same time, I would recommend checking with your provider.
I will tell you, Kenneth, that I did both. I did the flu and the COVID because I'm going overseas. And about 24 hours after doing it, I had a nice nap for about 16 hours. So like really, so it really depends upon the individual. And while it is again the general recommendation that they can be done together, the individual should be aware of the effects of these kinds of vaccines upon them, whether it's the flu vaccine or the RSV, or of course the COVID vaccine as well.
Yeah, absolutely. That's a great point.
I had one more question, and that is, does DOHMH have any guidance with regard to the pneumococcal vaccines, the pneumonia vaccines?
In truth, I'm not super familiar with that. I can do some digging on my end and have you something for next month. But yeah, that was news to me, unfortunately.
Okay. Thank you.
Okay, that's something we will put on the agenda. Let me ask about when someone does test. I know that many people are not testing anymore because I have a cold, I have a sniffle, I have this, I have that, or there's not presentation of anything. And the data that you did deliver for those who have either tested or and then were hospitalized afterwards, or were tested in the hospital. What are the recommendations for, you know, we know that the recommendations for isolation after a positive COVID test was 5 days of isolation, and then I believe wearing a mask around others for a few days. And what is the present recommendations around once one has a positive COVID test? What is the recommendations around isolation and masking?
Yes, that's a great question. So, so if you feel sick, and if you feel sick and you test negative, then of course there's nothing there. You don't have COVID, right? If you test positive, so this is a little complicated. So just bear with me here. So the day that you test is day 0. If you developed, so if you have symptoms, let me see, if you have no symptoms, then you can end your isolation after day 5. However, if you have symptoms and your symptoms are improving, then you can end it. You can also end after day 5 if you don't have a fever. Because of course, if you have a temperature, then that means that you could still be contagious. However, if your symptoms aren't improving, then you should continue to isolate until you do not have a fever. So
What about the masking issue? Masking?
yes, yeah, and of course, that goes along with, if you're going outside, you should have a mask on, especially within the first 5 days, because that's when you're most contagious. Now there are a few other caveats here. So if you have a more severe case of COVID, or moderate to severe illness, then it's recommended that you isolate for up to 10 days. And then anything more severe than that, you probably would want to go see a doctor or go to the hospital. So just to quickly recap, if you're not having any symptoms, 5 days, and then you're good to go. If you're having symptoms but you're not having a fever and your symptoms are getting better, then also after 5 days. However, if you are having a fever, or if you're having more severe, feeling moderate to severe illness, then you should continue to isolate until you start to feel better, or until you don't have a fever. And this is from the CDC, from the federal government.
Thank you. Any additional questions for Kenneth? I really, we've been on with you for quite some time here, maybe a little longer than we thought we would, but This is a serious issue.
Absolutely.
Everyone has returned to, I would say, well, not everyone, I have to take that back. Many have returned to a pre-COVID ethos of attending events and being on public transportation and going through workplace and all that kind of stuff. There are still many people wearing masks. I see that at all over the place. And as numbers climb and lower, I see more and more masks or less masks. So I think that's why I thought it was important for us to get the latest information and the insight into these various different vaccinations. So I really want to thank you for joining us tonight. Please feel free to stay with us for the rest of the meeting, or if you want to sign off and go back to your life, please feel free as well. Okay, thank you so much.
Thank you all. And if I may just offer just another comment just before I sign off. I just of course we have to just remind ourselves of some of the key tenets, especially as we get into flu season, right? And that's, they're really easy, washing your hands and really being mindful about how you're feeling. So of course, those of us that do have the privilege to work from home when we're not feeling well, that's always an option that we should take advantage of, so we don't expose individuals to any of our germs, whether they be COVID or not. Testing, there are still tons of testing resources available in the city. The federal government's doing another round of mailing home tests at people. So, I would recommend that people take advantage of that opportunity as well. And then just, shifting gears a little bit, I would be more than happy to arrange for, any kind of educational presentations, depending on, what kind of topics you all are interested in. We can talk more about this via email or another time. But, the health department has a wealth of subject matter experts and presentations that we're able to offer. So, please let me know, and I'd be happy to arrange something at some of our future meetings. And then lastly, we were talking about some of the social determinants of health and, some of the outcomes based on socioeconomic or neighborhood or race or other conditions. The health department has a pretty robust platform where we can kind of, it's a series of maps where we can kind of overlay different health outcomes and filter them based on certain conditions. And they're called the community health profiles. And it's a really robust web platform that our environmental health team has been working on for a few years now. We just recently updated it earlier in 2023 to kind of reflect some of the more recent data. So I think it'd be useful if we dove into that in one of our future meetings as well. So I just want to just leave.
Extremely helpful. Really,
yeah.
Extremely helpful. And looking forward to that. One thing to tuck away for the future as well is, of course, the issue of mental health.
Absolutely.
Yeah. We are going to be taking a deep dive into that in the very near future. Thank you so much. Appreciate it.
Thank you all. Hope you all have a good evening. Take care.
Thank you.
Thank you. I'm now going to go to, well, I don't have the minutes, but I'm going to, working from memory, as I mentioned, we're going to take some more deeper dives into certain of these arenas. One is going to be on the issue of maternal health care. We talked about that very deeply around the last time. Another one was the issue of mental health care. That's another deeper dive that we're going to be taking again in the near future. A third is of course the issue of aging in the community. One of the factors that again, working from my own knowledge and don't have the exact data in front of me, that the community up the hill, so to speak, the Riverdale 10463 up the hill, is generally an older population than down the hill. And that may be another factor that's playing into hospitalizations around various different chronic illnesses. So it's something that for us to take again, to unpack the data and see how that's affecting us. It's something that we will begin to do in the near future. So again, we will dive through our various different priorities, and again, I'll have the minutes ready. Again, my apologies. I just want to say one thing again about mental health. We are a highly traumatized society right now because of a number of issues, COVID amongst them. There's a lot of data on this. It's left a deep level of trauma, and it's now being identified and more unpacked by various different studies, both for more vulnerable populations, youth. There's a real impact study being done right now on the impact of youth, and particularly around education and mental health issues. So it's something that we're going to have to deal with. Yeah.
We also invite the senator from last night. Community involved on mental.
Sure. I wasn't on the.
Rivera.
Oh, you can speak to Gustavo. Sure, and we
Have him involved with mental.
certainly, we're going to take a deep dive into mental health, probably more than one session. We'll deal with the issue of mental health because mental health is a very complex issue. It's not something you can really unpack in one session. But not only do we want to unpack mental health, we want to be able to begin to develop an agenda that would address it in our area, because the issue of mental health is a very, very, very profound issue. Unfortunately, I missed the community board last night because there was and I'll use this as a preamble to part of the population, or many of the population, now larger parts of the population here in New York. I was at a rally last night. I'm not even sure of the right word for it, protesting or acknowledging or a vigil for the events that happened in Israel with the terrorist attacks over the weekend. As those issues, the depth of what those terrorist attacks look like are becoming now exposed. The barbarity of a number of those actions. Large segments of the population in Community Board 8 have relatives and family and other connections with Israel. I can only guarantee that there's a tremendous amount of loss here, but there's also a tremendous amount of fear and anxiety about what happened over the weekend. In the world of social media, stories that in the past may have been, let me just let somebody in. Stories that we may not have heard or been less exposed to. We're now seeing graphic examples on TikTok or Instagram or on television, and just things are really horrible in its impact upon society. So the issue of trauma within our society is another thing that we're going to take a very deep dive into. That's an important issue. Yes, please.
I also just wanted to add that Senator Rivera, I think he also would be a great person to come and meet with us or speak with us, because several years ago, probably 5 years ago, he offered a free Narcan training in the community. And, you know, I'm sure many people know about the baby who, that we lost a few weeks back from an exposure to fentanyl in a daycare center, and how devastating that is, not only for the family but also the wider community, and how that ripples throughout our entire neighborhood. And just to recognize that not only what egregious alleged network that these people were a part of, but it was a sophisticated effort, and I think also
it's now.
I don't want this baby's life to be lost in vain, and there's nothing that we can do to necessarily, there's nothing we can do to change and turn back time, but for us to be informed on fentanyl, how lethal it is, how little you need for it to be a lethal dose, how it is nearly accountable for 95% of drug-related deaths. It is
Really?
wild how
Right.
pervasive it is. I think, I was just trained on Narcan and opioids about a week ago, And so how, over just the span of a few years, that it was responsible for 5% of deaths, 20% of deaths, and now how it's so pervasive throughout the community. And a few blocks away from this daycare, they also confiscated more drugs. A few blocks away, there was a ghost gun in, I mean, that's not related to drugs, but, you know, like, so how in the community can we talk about fentanyl, raise it to the level of alarm that it is, and how it is moving through communities, not only ours, but...
It's manufactured in China and brought in through the Mexican cartel.
Yeah,
To stop it internationally.
I don't think we can do that, but we can, there are things we can do as a community. We can definitely talk about awareness and where it's coming from and how it's made, but there's, you know, for people who consume drugs, we don't, you know, we ideally not have people consuming drugs, but there are test slips that you can use in marijuana to determine if there's fentanyl in the marijuana. If you're, you know, so there's a lot of different things. Narcan, carrying it on you, recognizing when someone is on the street who's...
There is a van that goes around.
Yeah, so but like individuals, you can have your own Narcan. It's harmful, but like how can we learn more and recognize what a crisis we're living in right now?
So I think that's extremely important, and we will certainly contact not only the folks at DOHMH that have a lot of information and data around addiction. It was not, by the way, it wasn't just one arrest made after the death of that child. There was 3 of them within a mile of where that happened. And it's very true that while fentanyl may come in from certain places and distributed by certain people, it is a social disease when people need to take drugs in order to self-medicate, so to speak, against within society, and that's something we can address. But we will take a deep dive into that as well in the very near future. We have a limited amount of time, so I'm just going to, there's a couple of things of new business that have to be addressed as well. You know, somebody's here for a presentation around the issue of some of the changes, proposed changes for city employees and those who are retired in the type of health care they have. I want to do 2 things. It's been recommended to me by several people, Steve Fruit is amongst them, that we change the time of this meeting to 7:30 rather than 7 o'clock. I just want to find out how people feel about that. Excuse me?
That'd be fine.
8, okay. Any other thoughts?
I mean,
I
just,
prefer 7.
I was just gonna say, just for background, before COVID and, you know, doing all Zoom all the time, pure Zoom meetings, most committee meetings, with some exceptions like public safety and aging, which were held in the afternoon, most committee meetings, and I think the board meeting as well, began at 7:30. And, you know, with Zoom, people really were not traveling. They were not getting themselves to a location. So it was never an issue. But we've sort of retained the 7 o'clock on lots of committees. And I just was curious to know whether people would be willing to go back to the old, you know, the standard. And again, it's really only relevant, I think, or mostly relevant for people who are, you know, working full-time outside the Bronx, you know, and have to get there. That's all.
So, Margaret, any thoughts about that?
I also get up at 5 a.m. and I just drove here, so I feel you. I was not working in the Bronx today, so no matter how you slice it, it's not easy to get here in person. I was already 10 minutes late today, so I can't say that 7:30 will be a deal breaker for me. I don't have an opinion, whatever folks do. And I would say we have to have a hard stop at 8:30. We can't, like, meetings that stretch on.
Right.
Yeah,
Well,
3-hour meeting last night.
So, yeah, I'm almost happy I missed it. Sometimes they could be a little bit long.
Mhm.
Bob, maybe
So,
you can also talk to the people who didn't attend tonight's meeting and see what their feelings are.
I will do a poll. We won't change it for our next meeting. I will say that next month, we will not have a meeting in November. The reason for that is, the meeting would be close to, the Thanksgiving, holidays. I will be doing a lot of traveling in November, so I will not be available. And so we will meet, the next time I believe we will meet is in December. And hopefully we can begin to unpack one of these other issues. So that's the new business. Let me now turn to the presentation from Sue Ann. If you can give a presentation, there's a limit of 3 minutes, from my understand, that people can present. I think that's Julia. Is that correct? Julie?
Yes.
That is correct. Okay, please.
Okay, hi, my name is Sue Ellen Dodell, and I've been a North Riverdale resident for close to 40 years. I'm a city retiree, and I serve the city as an attorney. I assume that a lot of you heard my presentation in the Community Board's gallery session last night, so I'll be brief. And mostly I'd like to answer any questions from you. I'm here tonight to ask that you adopt a resolution to support City Council Bill Intro 1099. The bill adds just 2 sentences to the city's administrative code. The first sentence provides that the city must offer at least one Medigap plan to its retirees, and the second sentence provides that nothing in the legislation will interfere with the union's ability to collectively bargain for their employee members. For more than 50 years, city retirees have been promised traditional Medicare along with a supplemental plan, and the city has been trying to take that away and put us into an inferior Medicare Advantage plan. The mayor is doing that because way back in 2014, the Municipal Labor Committee took money from the city's health stabilization fund and used it to pay for teacher raises. They never paid it back. And so now the mayor and the unions have tried for 2 years to take away healthcare from retirees. If we're forced into this so-called Medicare Advantage plan, we'll lose access to doctors, hospitals, and treatments. And it's literally a matter of life and death. We've been fighting in the courts to keep our earned Medicare benefits. We've been batting 1,000 so far in court. We've won our 3 cases, but the mayor keeps appealing them. And of course, retirees live on fixed pensions, and we've been financing our lawsuits ourselves with small contributions, which is very tough for us. And some folks are telling us to wait until the lawsuits conclude, but lawsuits can go on for many years, and it has a real financial and psychological effect on retirees. And so I'd be happy to answer any questions that you might have. The legislation is important because the city has promised this to us. Retirees have planned for traditional Medicare, and we are hurting and afraid. We're concerned that we're going to lose access to our doctors while battling serious diseases. And we need your help because this is a national issue. If New York City moves ahead with this, other states and cities will follow, and that will hasten the end of Medicare, which is really one of the greatest healthcare programs in the country. So I'd be happy to answer any questions about Intro 1099 or about the resolution that we're asking you to adopt. And I appreciate the opportunity to testify today.
Thank you so much. Does anyone have any questions for Sue Ellen? So I know that people, as you said, heard your presentation last night. I will confer with Julie, and we no longer have a quorum here, so we can't even take a vote or have a discussion. The quorum person left. Apropos to our talking about timing, and I will discuss it with Julie as to what would be the next steps vis-a-vis the entire board, and how we can either bring it back to the committee or, and have a discussion, or we can discuss it on a board level. But I will speak to Julie and see how this works through the executive board level.
Okay, I
Thank you.
appreciate that very much, Rabbi, and I would appreciate if the committee you reviewed the resolution and adopted it and brought it to the full board.
Yeah, please.
Just an observation, Head Start is also going through a similar challenge in the city. It's, much of its staff is unionized and has a pension and health care option, and it looks as though the city is going to eliminate its, or has already severely cut back its healthcare options for Head Start staff members. And so this definitely seems like a trend across the city that it is no longer honoring collective bargaining agreements. I'm not sure if that's those are the terms under the benefits that you received or that were promised to you, but that certainly is an area of concern for longtime public servants.
Mhm. Yes, in our case, it was, yeah, it was in it was in documents that were provided to us over the last 50 years, actually, saying that we would have the choice of traditional Medicare along with a Medigap plan, something called a summary plan description of our healthcare.
I know that the whole issue of defined pensions and not healthcare insurance in general, but healthcare insurance being paid exclusively by employers is something that is quickly disappearing from the for-profit and the not-for-profit world as well. You know, the organization that I worked for up until 5 years ago had a defined pension plan. It no longer does. There's now some much smaller, much comprehensive plan of some contributions to our 403B because it's not for profit, and any health care benefits have been severely curtailed. So I have to agree with Margaret. It seems to be a trend, and personally, I can't say this professionally because I'm not allowed to what I do professionally. Personally, I feel that it is a very dangerous trend for the health care or the well-being of everyone in our city, apropos to what we were talking about before, particularly around the issue of healthcare disparities. So it's something that I think needs to be met, but again, I'll confer with Julie and figure out what the next steps are. If there are no additional questions, and I'm looking at the clock, it is time for adjournment, so if we can't even make a vote to adjourn, we're just going to have to say, that's all, folks. Good night.
Good night. Thanks for a good meeting.
Thank you all for being here.
Good night.
Good night.